Jacob. Thank you for being here. I appreciate the Philosophy Club and Jacob's diligent efforts. And it's a lot of work to get a professor to a university to give a talk. And Jacob did all of that work. And so thank you. Your diligence, your thoughtfulness, your attention to detail is much appreciated. And it's an honor to be here with you. So what I'm speaking about today is, it'll have a bearing on the issue of physicians and suicide, but that's not the principal topic. It's medicine as a profession. Medicine as a profession. And what does that mean? What is medicine as a profession? Going back to the kind of the origins of the word profession, which I'll be talking about. And the basic thesis that I want to present is that a profession involves a solemn promise to practice a technique or art, but one which one subordinates to an ethic, to some ethic internal to that practice. So it's not just a technique, it's a technique subordinated to an ethic, an account of what is good and an account of what is bad in that practice. So it involves solemn promising, but it's not just solemn promising. So my talk first, initially I'm going to talk about solemn promising, and then I'm going to talk about profession, and how professions are really species of solemn promising. Right? So the genus is solemn promising, and one of the species is professions, and one of the professions is medicine. Right? So that's kind of the structure of the talk. But I will be talking a little bit about Hippocrates, because Hippocrates was a real person. He lived around the time of the ancient Greek philosopher Socrates, with whom you may be more familiar. Socrates lived from about 469 to 399 BC in Athens, Greece. Hippocrates, who was his contemporary, was from the island of Kos, which is off present-day Turkey in the Aegean Sea. At the time when Hippocrates was born there, it would have been a colony of Athens, and he was a Greek. And he was a physician. He belonged to a family of physicians. And medicine at that time was always taught, medical instruction for the Greeks was a male physician teaching a related male. Okay? Hippocrates belonged to a family of physicians on that island of Kos, and he knew that other families who had this tradition of teaching medicine to male members had died out, because for all sorts of different reasons. But can you imagine, if you limit medical education to males that are related to you, you could see circumstances in which you're not going to have enough males related to a doctor to leave any legacy there. It's going to not have anyone to teach, right? So what Hippocrates did was he opened up medical education to non-related males. So he said, I will educate people who are not males, who are not related to me, in medicine. And when he did that, he belonged to a tradition of solemn promising, but he came up with something in addition to the solemn promise, like a contract. And that's why his school survived, because he educated non-related males, right? And that's why we still hear of him. These other schools of thought fell out of existence because they didn't have enough practitioners. So we'll be talking about Hippocrates a little bit. This is from my book, which was published by Oxford University Press in 2018, on the oath, on the Hippocratic Oath. When we call it the Hippocratic Oath, we have to be a little cautious, because we know there's a real person, Hippocrates. We know when he lived, we know where he lived, we know he was a physician, we know he radically changed medicine by opening up to people who were not related to him, teaching males who were not related to him. But we don't know exactly what he wrote. Okay, we know he wrote stuff. We know he gave lectures, things like that. But we can't say definitively he wrote this. So when I say the Hippocratic oath, you have to take that a little bit with a little grain of salt. I think he wrote it myself, but that's contested. Okay, so what they're talking about is solemn professing in medicine. And Hippocrates certainly belonged to a tradition of solemn promising. He would have made a solemn promise himself. He left us with the oath. And we've revived the practice of solemn promising in medicine. So in 1993, at Columbia University Medical School, there was a Dr. Gold, who was a professor there, who revived this practice in medical schools in the United States, which led to what's called the white coat ceremony. And the white coat ceremony, this is a Columbia University Medical School white coat ceremony. And these are medical students in their very first semester entering medical school, and they're making a solemn promise, and they're being endowed with a white coat, and that's called the white coat ceremony. Now, I believe every medical school in the United States now practices the white coat ceremony. So you have that at the beginning of medical school, and this solemn promising, right? Which I think makes sense that medicine would have solemn promising associated with it. But I do want to note, as I said at the very beginning, there's a distinction between solemn promising and professing. Just because you have a solemn promise doesn't mean you have a profession based on the ancient meanings of that word profession. So why would it make sense, just to deal with the solemn promising before we talk about professing, why does it make sense that medicine would have solemn promising, right? And I think there are various reasons on account of which it makes sense. Of course, we have the traditional reason that, well, they had the Hippocrates, they had a solemn promise in the history of medicine. That's a reason, certainly. But I think we could ask ourselves also, well, why would Hippocrates have had solemn promising, right? Like, why would it make sense to do that? And I think there are a number of reasons which I'd like to just think about briefly. First, you think about, when do we make solemn promises? We tend to make solemn promises around issues that have a certain gravity, a certain weightiness, a certain importance, right? Matters that deal with life and death. These are very serious matters, right? And medicine deals with those realities. So it would make sense that medicine would have the practice of solemn promising. We have solemn promising in other very weighty matters like justice, right? Lawyers have promises, make public promises. Judges make public promises. Police officers make public promises. So we have, they deal with weighty matters. Marriage deals with kind of transmission of life to the next generation. It deals with a weighty matter, and it's associated with a solemn promising. So it makes sense that medicine would be a practice that would involve solemn promising in light of what it deals with. Right? Also, a solemn promise, we make solemn promises. It shows that we're approaching these matters that have gravity with gravity. We're approaching them, these serious matters, when we make a promise concerning our activities concerning a serious matter. The fact that we're making a promise shows that we're approaching that serious matter seriously. Does that make sense? So we're doing it deliberately. We're doing it reflectively, right? When someone asks you to make a promise, you usually stop, right, and think, wait a second, what am I making a promise to? Promising tends to induce a kind of seriousness in those who are thinking about promising, right? So it makes sense that medicine would have a kind of seriousness in the attitude of the person who's committing herself to the practice of medicine. It's also, interestingly, there are scholars, right, of promising. There are people who study the practice of promising. And what they find is, and so this little pinky promise here, right? What they find is when we, human beings, when we make promises, it actually helps us to achieve the thing to which we promised ourselves, the act that we promised to do. Interesting for human beings, making promises increases the likelihood that you will do the act that you promised to perform. It's a fact. This is like an empirically established characteristic of human beings, that they achieve the things that they have a higher achievement rate of concerning those things they promised to do than concerning those things they haven't promised to do. Kind of makes it interesting. And there are reasons to think, well, there are various reasons why this may be true, right? Scholars of promising suggest that people, we humans, we like to keep promises. Like, we want to think of ourselves as people who keep promises, right? Also, when we make a promise, we make promises to people, right? So we have someone who will keep us to our promise, right? Kind of someone who will kind of make sure we fulfill our promise. And then also, promises typically involve, like, cross my heart or something like that. Or, as the Hippocrates goes, he swears by all the gods and goddesses, right? Typically, we promise by something that we hold to be elevated or of great significance or importance, not just to a person, but also by entities, realities in our life, my mother's grave or my father's grave or something like that we treat as of great significance. So it looks as if medicine, it makes sense that medicine would involve promising, because medicine is actually a difficult practice. It's difficult to achieve the goals of medicine. And so making promises that one would do that will facilitate that, and so it would make sense that medicine would involve promising. It's also the case that promises focus deliberation. So promises kind of tell us, this is what I need to think about, and I don't need to think about these other things, right? So, as Aristotle says, that physicians don't deliberate about are they going to heal, right? That's just, they've made that commitment. They deliberate about how to do it and things like that, but not about whether, right? So promises, like, focus our deliberation, tell us what to think about and what not to think about, right? I had a promise to Jacob to come here and meet around 11:30 or thereabouts. So I'm driving along. If I see, like, oh, Denny's has got a special, I was like, maybe I'll drive. No, I've got a promise. I've got to honor that. I'm not going to think about Denny's special sale or anything like that. I'm going to focus my deliberations on going to Sacramento State. And also, promises define the path for our practical activity, right? So, interestingly, in the ancient Greek word porkos, that's their Greek word for a promise, that word also means like a boundary, a path, right? It defines the path that we're going to walk on, right? And that enables, when we have like these runners are on a path, right? And it tells them which way to run, kind of the direction, how we talk about it focuses our deliberation, but it kind of points us in a certain direction as well, and defines, what is the path that I need to stay on in this practical activity. So, and we see that in the ancient Greek word, like boundary, for a promise. Now, also, interestingly, promises, this is the Latin word meaning explaining. Explaining. That which explains. That which explains. Promises explain our conduct to others, right? So, when you make a promise, let's say you have a married couple and they promise fidelity, and then someone makes a proposal of a liaison, right? to one of the married couples, the married person says, well, I'm married. I made a promise. I'm married. That explains, right, why they wouldn't engage in a romantic relationship, right? Because they made a promise. Now, promises explain our conduct, but they don't necessarily justify it. So they say, that's why I am doing what I'm, or not doing that act. But they don't necessarily justify doing or not doing, right? Because the question is, are they a good promise to ask? Not only is, yeah, I promised that, but that means it explains why I'm doing or not doing something. But it doesn't necessarily justify my doing or not doing that. It has to be a good promise, right, in order for it to be a source of justification. But it does explain our conduct. All right. Now, I want to shift gears here. We've thought about why does medicine involve promising? Why would it make sense that it involves promising? But I want to move now to consideration of medicine as a profession. Because as I mentioned at the beginning, profession is a species of promising, right? It's a special kind of promising, a promising subordinating one's activity to an ethic. Okay, and I was trying to think of if we could have a promise. What would a promise look like, which isn't subordinating itself really to an ethic internal to itself, right? What would that be like? What would such a promise be like? And I think it would have these elements here, right? So you could have a promise of some practitioner, right? Of any could be any kind of practice, but medicine included, but it's not exclusive to medicine. But it would be to practice this to practice this art or technique legally, right? You're just going to do it legally. You do it, right, as is requested by competent subjects, right? And those are, we can think of these people are clients or customers or consumers, right? These are terms. Notice that there wouldn't necessarily be a patient, right? Because a patient is a Latin word meaning one who suffers, right? If you think of, if someone's thinking of the subject who they are practicing their art on as a customer or a client or a consumer, right? They're not thinking of them necessarily as a patient, as one who is suffering. So, but you could have this art practiced upon competent subjects, right? You could say, you could have some ethical kind of commitments. You won't gossip about these people. You'll observe confidentiality. You're not going to resort to sexual predation on them, right? And you're do things like report conflicts of interest, right? And you'll practice competence, right? Now, the point I want to make of all of these commitments, right? The thing about it is they all come from outside of the practice, right? They're commitments that come outside of the practice, right? They're not part of the practice. They're coming from outside. Like, so what I mean is, if I say, look, I'm going to practice this craft within the boundaries of the law, then I'm not following any norm of the practice. I'm saying I'm going to follow norms that come from outside of the practice, right? Which is fine. I'm not quarreling with them, but it's important to note, because this is what I take to be the difference between making a solemn promise and practicing a profession. Professions have their own internal codes of morality. Their codes, their norms of conduct are not simply coming from outside of the craft. Okay. And so what preceded that was kind of like what I call a technical promise, right? Or a promise of technique. Just a craft, a promise that I will practice this craft within the boundaries of law and convention, but it itself, I don't have any constraints imposed on it otherwise. And this kind of is, if we're going to think of medicine along these, this is kind of thinking of medicine as a technique. It's a technique, it's a craft, it's subordinated to these external norms, but it doesn't have any internal ethic of its own. I think a lot of contemporary medicine is conceived of in this way. Okay? It's conceived of as kind of a craft that's going to be practiced under the constraints that are imposed on it by law and convention. But that's not a profession, right? So it's what we are seeing here then is like it's a profession of technique, right? It's a technique, and I will use it as is legal and as is requested by competent subjects upon whom I will practice the technique. All right. Now, if in history that a profession of technique that differs profoundly from what Hippocrates is thinking, and also from medicine as a profession, if we go back in the history of medicine. Okay, and this is a cover to a book by a physician, Scribonius Largus, who was he was a physician in Rome in the 1st century A.D., and he refers to Hippocrates, to medicine as a profession. Okay. What's interesting, just about if we look at the history of the word profession, it's a Latin word, so it would come from Rome, Latin, and it means pro means in front of, and factio comes from Latin fatere, to speak. So really, what it means is to speak in front of. That's literally what it means. But if we look at its history of the first usages of it, people who practice crafts or techniques would make professions in front of the tax collector in Rome. Okay? So, and they would say, I am a physician, I am a plumber, I am a teacher, I am an orator, and then they would be taxed in accordance with their profession, whatever it is. So his very first usage was by the tax authorities, okay? That was his first usage. But very quickly, it came to be used to identify not just a craft, not just the practitioner of a craft, but the practitioner of a craft who subordinated the craft to an ethic. So it was a practitioner of crafts who were saying, I will use my craft for this purpose, but I will not use it for these other purposes. I will pursue these goods, but I will avoid these bads. Right? So it brought into, right at the very origins of the word, it meant someone who practiced a craft with an ethic, with moral commitments that were really part of that craft, or that craft was subordinated to those moral commitments. So if we look at, this is Largus speaking about Hippocrates in this work in the early 1st century or thereabouts. Hippocrates, the founder of our profession, right, handed on to our discipline an oath, right? And the conservation of the name and honor of medicine with a holy and devoted heart has been greatly valued by every man who has behaved himself according to Hippocrates' creed, for medicine is a science of healing, not of harming, right? So the idea there is we have a profession when we have a practice that's subordinated to an ethic, where it's to heal and not to harm. So now we have more than just the craft, because the craft is the ability that enables you to heal and to harm, right? But we have a profession because we say we're going to take the craft and we're going to use it to heal and not to And Edelstein, who's one of the great historians of medicine, he writes about this use of the word profession by Scribonius. He says, and I'm quoting Edelstein, this word profession, in the language of Scribonius' time, was applied to crafts in preference to the older and morally indefinite term. Right? Morally indefinite because it was like, what are you going to do with that? You could use it for good or bad. But if it's a profession, it has ends intrinsic to itself. It's committed to certain goals and opposed to others. And so, Edelstein says, Scribonius uses this term to emphasize the ethical connotations of the craft, the idea of an obligation or duty on the part of those engaged in the craft. Right? So here we're getting to the idea that a profession is not just a promise. It involves more than promising. It involves promising, but promising that you're going to follow, you're going to use the craft in a certain manner and not use it in another manner. So this, this view, I think, of medicine as a technique, right, is kind of has a hollow. Medicine is kind of a hollow thing. It doesn't have any internal ethic internal to itself, right? Or you can see it's like the physician and the medical practitioner, physician or nurse or physical therapist, would just be kind of a blank, kind of, there's no interior ethic, right, to the practitioner. Right? By contrast, if we think of a profession, right, a profession has autonomy. That's a Greek word, autos, meaning self, and nomos, law. Meaning it gives itself the law that it's going to follow. And therefore it has autonomy. The profession has autonomy, and the professionals have autonomy because they have their craft, and they're committing the craft. They're subordinating the craft to the law, to the nomos that they're committed to the ethic to which they are committed. And so this view of profession, right, is an idea of a practice that has a morality internal to itself, an internal morality. It's not just coming from outside, it's not just the law and convention and what people want, but the actual practitioner has commitments, right, given her conception of her craft and how she's going to use it. Okay, so now, but just to think of some historical examples, hopefully, that are helpful. In the history of medicine, we could see instances where physicians conceived of themselves as technicians. It's kind of technicians, not as professionals, but as people who have a technique, and that technique can be used for all sorts of different purposes. And two of those people would be Dr. Guillotine and Louise. Dr. Guillotine and Louise. Guillotine was a physician. The guillotine is named after him. The guillotine, the instrument of capital punishment, which was used in the French Revolution, and which actually was used in France for generations, was a method for killing people. And it was proposed by Guillotine. And Guillotine was very humanitarianly motivated because I know it's puzzling. It's like, why would he do that? Well, here's when he proposed the guillotine. It wasn't called the guillotine, and his family actually changed their name because they didn't want to be associated with the guillotine. But the machine was named after him because he proposed it. But why did he propose it? Well, he proposed it because at the time that he proposed this method of killing people were different. People from different classes were killed differently in France. So if you were from the nobility, you were decapitated with a sword. your head was cut off with a hatchet. If you were from the lower classes, you were hanged. Guillotine thought we should kill everyone the same way, right? He's egalitarian, right? This is true. I'm not making this up. He had an egalitarian saying if we kill someone, we should kill everyone the same way, and this is the way we should kill them, because this is a very humane way to kill someone. Now notice this makes perfect sense for a doctor, right? Understanding medicine as a technique, who better can kill patients? Who not a patient, but who better can kill? Right? The doctor is a great. We see this now. People are trying to get doctors to administer capital punishment. It's happened before. But that's conceiving of medicine as just a technique, not subordinated to an ethic, right? Of course, the condemned individual, whatever you think of the death penalty, right? They're not a patient. They're not suffering from a disease, right? They're not a subject for medical treatment. If we conceive of medicine as a technique, it makes perfect sense. And actually, Louis was Guillotine's colleague, and he was a surgeon, and he studied what is the best angle for the blade to cut off a head. Like what is the best way to do that? And they designed the blade accordingly. So that's this conception of medicine as a technique, not as a profession. Now, Hippocrates was this ancient Greek who was concerned that medicine not be conceived of just as a technique. And what was partially motivating him is an awareness from the Greek culture that there's an intimate relationship between wounding and healing. And in the ancient Greek culture, this is from my book, this is just to tell you a little story, that this is Achilles, and this is a man named this is a sculpture. This is Achilles, and this is a man named Telephus. And you wonder, what the heck is Achilles doing? Achilles is this is a knife, he's scraping little metal shavings from this spear into Telephus's abdomen. What's going on here? Well, in the story of the Iliad, by Homer, Achilles, which would have been like the Bible for the ancient Greeks, Achilles went to Troy to defeat the Trojans. But before he went to Troy, he thought he mistakenly attacked Telephus's city. Telephus successfully defended his city against Achilles, but he was wounded by Achilles, and his wound wouldn't heal. So, being a good Greek, Telephus went to the Delphic oracle at Delphi, the priestess of Apollo, the sun god, who was also the god of healing. And he said, "How will I be healed?" And the prophetess, the priestess says, "The wounder heals." Okay, the wounder heals. Now, that phrase, "the wounder heals," is a phrase that every Greek would have been familiar with. It was part of their culture, this concept that the wounder heals. And so Telephus went to Achilles. Achilles heals him. What is the relevance for Hippocrates? Well, the relevance is that if the wounder heals, then it's also true that the healer wounds. Right? The healer wounds. If the wounder heals, then you can think of that as the wounder heals is the homeopathic principle, right? In medicine, we have homeopathy. Homeos means similar, like, and pathos is disease. And we know that things that are similar to the disease actually can heal us of diseases. That's what vaccination and things like inoculation and stuff, things like that, are homeopathic in this sense of the word. The Greeks were aware of that. Hippocrates was aware of homeopathic medicine. But the counter kind of the isomorphic, or the kind of match to the fact that the wounder heals, is that the healer can wound, right? It's like a symmetrical match. And that's, in Greek, we have the iatrogenic principle. Iatros, like so many words in medicine, it comes from the Greek. Iatros is physician, and genos means caused by. And so we have illnesses that are caused by physicians, right? Iatrogenic illnesses are caused by medical practitioners. That's what Hippocrates was preoccupied with, preventing the healer from wounding. And so that is, how are you going to do that? You're going to commit the technique, the art of healing, which also can wound, is going to be subordinated to an ethic. And when you do that, you've made it into a profession, which you're going to make a promise to that ethic in front of others, right? So, just to give you some text from Hippocrates, this is from the Epidemics, which we're pretty sure that Hippocrates wrote, especially the early books, and it's from the first book of the Epidemics, in which he recounts diseases that he saw. And this, what is in the Greek, what he's saying here, this is kind of probably the most famous medical ethic in the history of the world. And what he says here is, as to diseases, practice two things: help, or at least do no harm. Right? That comes to be called, first, do no harm. That comes from Hippocrates through the Romans all the way to present day, where you'll hear people say, first, do no harm. That's like the basic medical ethic of medicine. Now, interestingly, Galen, this is a statue of Galen. Galen was a physician in Rome from about 125 or thereabouts to 210 AD, and he took care of Marcus Aurelius, the emperor of Rome. He was Marcus Aurelius's physician, and he also was physician to gladiators. All right, you think, why? He took care of gladiators and the emperor. But the thing is, what's interesting is gladiators were very valuable. And so they were cared for by the best physicians. Right? That tells us that Galen was one of the great, of course, the fact that he took care of the emperor of Rome, Marcus Aurelius, tells us that as well. But the fact that he took care of gladiators indicates, what a wonderful physician he was. But Galen, when he read this statement of Hippocrates, he was one of the great commentators on Hippocrates, a great student of Hippocrates, and he said he thought it was beneath Hippocrates to say, as to first do no harm. He thought that, why would you even mention that? Does not need you to say that. It's so basic. It's silly that you would even spend your time to say that, Hippocrates, right? And here's what Galen writes, though. He writes, "For those who learn the art, I know that, as it was for me, the maxim, do no harm, seems not to be worthy to have been written by Hippocrates." Why did he even bother saying that? "But for those who subsequently practice medicine, I know very well that the force of the phrase will be clear." So what Galen is saying is, to a novice, it seems silly to even say that. But as you become more and more familiar with the practice of medicine, you realize that, yes, first, do no harm. Help and don't hurt anybody. Because medicine is dangerous. That's what Hippocrates is really sensitive to. This is a fresco of Aquinas, who was a medieval philosopher in the 1200s. And Aquinas says, the first principle of, when we do anything, the first principle that we have in our actions is to do what is good and to avoid what is bad. Right? And if you think about it, that Aquinas is saying that's the first principle of all human activity. And most people say, yeah, Aquinas, you're not really telling me anything about what I know, right? You're not doing that. And that's what Aquinas is saying. You know that. You know that you should do what is good and avoid what is bad. In medicine, right, what Hippocrates, when he says first do no harm, or as to diseases practice, do help or don't harm, heal or don't sicken, right? He's just saying that principle, the first principle that Aquinas is talking about, in medicine, in the field of medicine, where we practice. He's just articulating that generic principle specifically in this field of practicing medicine. And if you look at the oath, the oath of Hippocrates' oath, you'll find he just very simply says, right, regimens I will use for the benefit of the sick according to my ability and judgment. Right? So he's talking about regimens, that just physical remedies, these techniques that I have in my craft, I'm going to use for the benefit of the sick. So notice he's talking about taking care of sick people. So he's not talking about taking care of clients or customers, or he's talking about taking care of sick people. Those are his subjects that he cares for, upon whom he practices his craft. And whatever he says, whatever is used for harm and injustice, I will keep away from the sick. And this bears on what Jacob had mentioned earlier about physicians' suicide. The first thing he says is, I will neither give a deadly drug to anyone though having been asked, nor will I lead the way to such counsel. So once he said, I'm going to use my craft for the benefit of the sick and to keep them away from harm and injustice, then he identifies, well, what would be harm and injustice in his opinion and in his craft, concerning his craft. Right? So people obviously must have asked Hippocrates, because he's practicing his craft, in which he uses these drugs, that some of which are lethal. He doesn't use them insofar as they're lethal, but he uses them, he knows that they can be lethal. And then people would ask him, would you do that? And he says, no, I'm not going to do that. That's not my craft. My craft is limited by my commitment to benefit the sick and not to harm them, and he regards that as a harm. Right? And that's what I'm saying, that solemn promising, which is part of the oath, that makes it a profession now, in the sense of, it's not just a solemn promise, it's a solemn promise committed to an ethic, committed to an internal morality, internal to itself. And so, right, that's what Hippocrates is just concerned that the physician would not become, right, a person who would use the craft to harm. And the anthropologist Margaret Mead, she's writing about Hippocrates. She says, for the first time in our tradition, there was a complete, with the Hippocratic oath, right, there was a complete separation between killing and curing. Throughout the primitive world, the doctor and the sorcerer tended to be the same person. He with power to kill had power to cure, including especially the undoing of his own killing. He who had power to cure would necessarily also be able to kill. With the Greeks and Hippocrates, the distinction was made clear. One profession was to be dedicated completely to life under all circumstances, regardless of rank, age, intellect. This is a priceless possession which we cannot afford to tarnish, but society is always attempting to make the physician into a killer, right? That we see it, as I said, on our way here, we drove by St. Quentin State Prison, where the death penalty is still on the table, and where people try to get physicians involved in that, violating it as a profession. Right? I want to remind ourselves of Hippocrates making medicine a profession, a craft subordinated to an ethic. I want to acknowledge that this is a monolith, right? Medicine is not monolithic. It's not just one profession. I think we have to realize that maybe generations ago, there was one profession of medicine. There was kind of unanimity, right, concerning ethics and codes of what is this profession committed to. So I think it would be naive to think that medicine is still one, right, one profession, everybody's committed to the same code, right? And actually, if we look at the first photograph, or the second photograph we had, as I conclude now, was of students who were taking profession, but these solemn promises at all the medical schools, they all differ, and even people can write their own promise, right? Be that as it may, I do want to maintain, well, there's not one profession, one monolithic profession of medicine. There might be many professions, right? There might be many professions, many different accounts of what is what this craft should be subordinated to. What makes them professions, and not just solemn promises, is a commitment to an ethic. And so I think that when in this practice of solemn promising has been revived, and that's wonderful, but we do need to use the word accurately and ask, okay, what is the ethic to which you've committed that's internal to your practice, that's not just imposed from outside? Okay, so I want to thank you very much for your attention.
Yeah, we'll do, what time is it now? Maybe 20 minutes,
yeah.
Questions? Yeah. I can start. I was going to